name is Dr. Hamilton here at South OC Chiropractic. I want to talk to you today about numbness, weakness, and tingling coming down to the arms. There's many different types of nerve entrapment that can cause this type of problem. So what you'll want to do is evaluate where are you experiencing the symptoms and what is going to be the best way to approach these types of issues. So when we're taking a look at these types of problems, you always want to start from the proximal to the distal end here to evaluate what's happening. For example, if an individual has a disc herniation, it can cause issues all the way down with pain, numbness, and tingling into the thumb. So you want to evaluate where those nerves actually can have their entrapment points. The nerves, as they come out of the neck, supply all the musculature down to the arm. So it can get entrapped actually as it comes out of the spine, which can be from a disc herniation or disc degeneration. Can also be entrapped right here if you end up having tight scalenes, or in the pec minor causing thoracic outlet syndrome, which many times we're finding with people who have rounded shoulders because of poor posture. Now it can also have entrapments as it comes down to the arm. If you're having tingling into the thumb, it can actually get entrapped right here in the pronator teres, which actually causes a good amount of carpal tunnel surgeries, because the surgeries in carpal tunnel are only effective about 50% of the time. And the reason that they're only effective 50% of the time is because we have other sources of entrapment. So that's why as we go down, we want to assess all these sources of entrapment to see what could be the #1 cause. And if we have multiple sites of entrapment, all of them need to be addressed to get the best result possible. So if you're experiencing these issues all the way down to your hand, assess which area they're actually going towards. So if you have numbness and tingling actually, or pain into your pinky finger and ring finger, that's normally going to be what we call an ulnar nerve distribution. The ulnar nerve many times can get entrapped actually in the neck or in the elbow, causing cubital tunnel, or also in the tunnel of guyon. In the tunnel of guyon, actually, it's very common to find people who end up actually riding motorcycles, bicycle riders, cyclists actually have this issue all the time from leaning forward. That's why we have to go through and evaluate what's going to be the best form of treatment actually for that. If you have numbness, weakness, or tingling actually in the thumb, in actually the index finger as well as the middle finger, what you'll want to do at that point is see where do the symptoms start. You can have entrapment in the pronator teres here, but only experience symptoms actually into the hand. That's why always seeing a licensed chiropractor or a doctor to have a full evaluation x-ray to find out where these problems are starting from and how they should be addressed is going to be your best option. There's a couple stretches you're going to want to try before you end up actually trying anything else such as medication for these types of things. The first one is if you're suffering actually from that numbness, weakness, or tingling in these fingers, these two distal fingers will be the ulnar nerve distribution. So what you'll do is you'll take actually your hand and make an OK sign with it. You'll put your middle finger underneath the chin. You'll flip up and try and put this circle over your eye. Hold that for 3 seconds, relax, and then repeat 10 more times. What that's going to do is that's a nerve flossing technique that will take the nerve, stretch the nerve out, and any areas that have adhesions will start to loosen up and hopefully take care of some of the problems you may be experiencing from this. Now, if you have the symptoms actually in the thumb, the index finger, as well as the middle finger, you'll first off want to start actually with a pec stretch, because many times these issues are stemming actually from the neck or the chest, and as I said, poor posture has a significant effect on this. So you'll start with actually pinky down up against the wall, outside footsteps forward. You'll push forward, kind of turning out slightly actually on the shoulder. Hold that for a minute. Come back into this position. Put it right in the middle of the wall. Exact same thing. Push forward. Breathe deeply and really focus on your breath. Hold for a minute. And last one, 45-degree angle, pushing forward, lean forward, stretch that out, and you should feel that stretching all through the arm. Then what you'll want to do is you'll want to do a median nerve flossing technique. Now, anybody who has carpal tunnel or any issues in the thumb should be trying these out as long as it's not causing aggravation to the symptoms. Initially, what you'll do is you'll turn the hands out, thumbs need to be out, and you'll extend actually the wrist. You may feel a bit of tension in there as that happens. What you're going to do at that point is you can put it up against the wall, turn the thumb out, and you'll take 2 steps forward just to make sure to open that area up, and you will feel a little bit of a pull into the arm. Do not push too hard into this as it can aggravate the symptoms, which means you do want to ice after this if you do have increased symptomatology. As you do that, you're going to hold for a minute, take another step forward, and then you can use the fingers to crawl up the wall with your thumb turned out to make sure that you're getting a little bit of a deeper stretch. These are some very basic nerve flossing techniques, can help a lot with the symptomatology you could be having into your arms. So if you have these types of problems, make sure to see your chiropractor, your doctor to get an accurate diagnosis, figure out the best way to approach it, and make sure we can take care of these symptoms for you. And just remember, when your body's out of whack, the doctors at South OC Chiropractic have your back.